go through briefings and staff meetings, trying to decide what is best for us here in Riverside County. So Jeff, why don't you explain more of the details?
Sure. Thank you, Supervisor. I will hit, as I always do, the case information, then go into a little bit more of the details. As of yesterday at 1:30, total confirmed cases in the county is 2,960. In Corona, it's 147 cases. Total deaths countywide is 93. In Corona, that number is 5. The total recovered number is something that we're excited about. That is now up to 757. As Supervisor Spiegel indicated, our positive trends are continuing. Our doubling time has extended to more than 8 days, and that is even with our increased testing. Hospital bed utilization is at 57%, ICU bed utilization at 69%, and ventilator utilization, which was our worry 3 weeks ago, is at 30%. As a result, we've updated our models and we've revised our plans. I spoke last week about our SNF outreach and support teams. They have been very, very successful. As of yesterday, we have met with 50 of the 56 SNFs. The handful of what's left, I think 3 or 4 of them are associated with hospitals and did not need our support. The remainders, we are working right now to get in and help them. We've expanded now to assisted living facilities, and we're going to extend now to homeless shelters. We've been so impressed with this program that it's going to be part of our coordination efforts even after the pandemic to make sure that SNFs, homeless shelters, and assisted living facilities are supported at the county level. Our FMS is up in Indio and in Riverside. Community drive-through testing is in Indio, Lake Elsinore, Riverside, and Paris. We have a 5th site in Blythe that stood up for this week to get a sense of what's happening in Blythe. We are now testing asymptomatic, that is folks who are not showing any symptoms of having COVID-19 at our community sites. We recognize this is simply a point-in-time test, but it will also help us get an understanding of the prevalence of this disease in the community. I know there's a question about antibody testing. To date, our public health folks have been a little concerned about what the value of that is, both in terms of the reliability and what it ultimately tells us if somebody does have the antibodies. But it is something that we're looking at extending and trying to see if we can get some of those tests and rolling them out in the county. The discussions that Supervisor Spiegel is talking about is the procedure and timeline for a strategic rollback of public health orders and the mitigation measures. We have reduced restrictions on golf and other outdoor activities. We are reviewing our other orders, and we are continuing to identify the best metrics that will help us guide those decisions moving forward. We want to make sure that we normalize for our increased testing. For example, we will continue to see our confirmed cases rise, but that is natural, one, because it's happening everywhere, but also we are testing at a level that is much greater than any of the other counties surrounding us, and more so than most of the counties in the state. So just looking at the number of confirmed cases is not enough. We need to look at other things in terms of percentage of cases, positives, percentage of tests, and those sorts of things. As always, rumor control, when in doubt, reach out. Please feel free to contact me. Essential county services are continuing, and I will continue to remind you to look at our county website for public health, rivcoph.org/coronavirus. We are getting roughly $500,000 tells you where mine is these days, 500,000 visits to that website every week. And we're continuing to update it and identify better ways in which we present the information. Absent further questions, that is the end of the report from the county.
Thank you, Jeff, and thank you, Supervisor Spiegel. Desiree, do we have any other questions for the supervisor or for Jeff?
I believe Jeff answered the first question that we had earlier about capability to test employees for the county without any symptoms showing. So you did touch base on that.
And just Desiree, just for the record on that, that is, you need to call and make an appointment with our drive-in testing.
Right, and do you have that number for people?
I don't have it in front of me right now, but I can send it to you after this call.
Absolutely, great. And then one more question is, where are the community sites that conduct the testing and how do we sign up?
Perfect. We have one at the Indio Fairgrounds. We have one at Lake Elsinore Diamond Stadium. We have one in the city of Riverside at the Harvest Church, and we have one at the Paris Fairgrounds in Paris. We also stood one up today in Blythe at the fairgrounds out there. And the way to make an appointment is the 1-800 number that I will send you, Desiree, as soon as we're done.
Great, thank you.
Or as soon as I'm done. You'll probably get it before your phone call ends.
Oh, okay, great, great.
Thank you very much. Now we would like to turn our attention to the city of Corona and turn the time over to our mayor, Mayor Jim Steiner.
Oh, good morning, everybody. You can all hear me, right?
Yes.
Yes.
Okay, good. As shared prior, I just want to again remind everyone that essential city workers city services, excuse me, continue to operate while practicing our safety guidelines. Maintaining these services and the well-being of our community is our priority. We now have over 305 city employees working remotely. Plan check submissions are going smoothly. Please let Ryan Cortez know if you encounter any problems. And also additionally, staff is available at any time to do Zoom meetings as well. And Ryan is on this call, I believe, if you have any specific economic development questions. As I'm sure you have all heard by now, the Senate passed an additional $484 billion relief package. This still needs to be approved by the House, I believe, but if that hasn't happened, it likely will happen in the next day or two, I hope. $310 billion of this will replenish the Paycheck Protection Program, and an additional $60 billion will fund emergency business grants. Although it took a little longer than expected to get this round of funding released, we're hopeful additional Corona businesses will receive these funds. The city is continuing to disseminate information on the application process for these programs. Please encourage anyone who has not applied to do so. Lastly, as I shared last week, the city will be working to share tools and information on business recovery. We acknowledge how difficult it may be and are working to bring some answers to the many uncertain questions that you all have. Small business consulting is available through the Inland Empire Women's Business Center, SCORE, S-C-O-R-E, and the Inland Empire Small Business Development Center. Additionally, the city will be sharing information on upcoming webinars from industry experts about the next steps of business recovery. Nearly all of the services are free, so that's cool. I encourage you to reach out and share these opportunities with those in your circle. And again, if you have any specific questions, you can direct them to me or Ryan Cortez, and we'll assist however we can. And lastly, I just want to thank the Chamber and the entire business community for everything they're doing. Even during these difficult times, we have numerous organizations reaching out, looking for ways to be of service. So can't thank them enough. And with that, I would like to turn it over to our city manager, Jacob Ellis, who will be followed by our fire chief, Brian Young.
Okay, thank you, Mayor. Guys, thanks for the opportunity to join you on the call this morning. I'm just going to make a few comments. First of all, just to give a little context for what we're up to. So I participate in regional calls with all of the city managers throughout the region on a weekly basis. And we talk a lot about COVID and the impact on our cities. Every discussion includes a lot of talk around how our business community is doing. And I think it goes without saying that we're all very anxious to see our businesses reopen. One of the things that is obviously top of mind that we've been talking a lot about is the financial distress that the pandemic has put on cities across the region, the state, nationally, you see. Fortunately for us here in Corona, we're not as dependent on tourism and some of those large sporting events and TOT revenue to keep the city operating. If you look just even locally with some of our neighboring cities like Anaheim and Santa Monica, some of the desert cities as well in Riverside County, they're looking at some major budget cuts as a result of some of those major revenue sources getting virtually shut down. So I thought it might be of interest just to briefly share how some of the recent events have impacted our financial condition in the city and what next year's budget is going to look like. In terms of Q4 of this year, our sales tax are down about just under 10%. So we're looking at a $3.9 million loss of revenue in Q4. I'm sorry? Oh, never mind. Our transient occupancy tax, so that's our hotel tax, that's down. We're seeing occupancy down about 75 to 80% in Q4, so that's a loss of about another $1 million. Library recreation service revenues are down about $650,000. Property taxes, those obviously there's a delay to the impact with those, but we are factoring in about $275,000 in revenue losses due to higher delinquencies and potential waiver of penalties. That's what we're planning on, as well as some losses and transfers in from gas tax of about $350,000. So Total general fund Q4 reduction, we're expecting about a loss of $6 million for this fourth quarter of the year. We also are seeing losses in revenue for our road-related funds, gas tax, RMRA and Measure A funds. The total impact of that is about 1.2 to 2.2 million. So all in for Q4, we're seeing a reduction of about 7.2 to 8.2 million. So that's obviously requiring us to take a hard look at what we are spending our money on and how we're going to adjust to deal with that. We're also seeing some additional costs, obviously, due to COVID. We're up to nearly 400,000 additional costs that we've spent responding to COVID just here in the city. We are obviously hopeful that we will get some reimbursements of some of these expenditures through FEMA, but nonetheless, that's still very real. The final other major impact that we see is from our CalPERS investment losses. As all of you know, about 2 months ago, we did a presentation in our council meeting to talk about our $271 million deficit or unfunded liability that we have through CalPERS. CalPERS generally bases its returns on a 7% return rate. As of March 31st, it was -4%. That is likely to result in millions of dollars in increased costs to the city as a result of that. Now, there's a 2-year lag, so we don't see that immediately, but that is nonetheless a still very concerning financial impact. Many of you know, so far we still have no stimulus money for cities with a population under 500,000. We also have our small business tax deferrals. About 80% of our Corona businesses would fall into this category. So we see a estimated general fund impact cash flow issue of at least 1.4 million. So we continue to see some of those impacts, and we are preparing our upcoming FY21 budget. The estimated deficit or loss of revenue that we are planning on is about an $11 million shortfall for next year for our general fund. So that's something that we are working very hard on, identifying ways that we can find every cost savings that we can, trim back wherever possible, but try to really minimize the cuts to services that our residents and businesses need and rely on. So we're looking at every different option we have available to us to try to close that gap. So obviously it's going to be a tough year ahead, but we're still hopeful that our efforts over the past 6+ weeks in managing the pandemic will allow us to begin taking steps to return to normal. But as Supervisor Spiegel said earlier, we're optimistic, but what exactly that looks like and when, we're still all figuring that out. So appreciate the time this morning. Hopefully that gives you some idea of what the Q4 looks like for the city, as well as what our upcoming budget year situation looks like. And with that, I'll turn the time over to Brian Young, our Fire Chief and Emergency Services Director.
Good morning, everybody. Just want to give you a quick update from the emergency response perspective from the EOC. As you already heard from the county, we're working very closely with them as a subordinate partner. The EOC remains activated at level 2, which is the second highest level. A lot of that has been in order to prepare us for what we've been dealing with the last 6 weeks. We have seen a lot of impacts on various different aspects. A prime example is call volume for emergency services is generally down in the city of Corona. And we attribute that to multiple things. Obviously, with businesses being closed, less people being on the roads, there is actually a positive impact from this is that there's a decrease in traumatic injuries and things of that nature, whether it be in the workplace or on the road. So that is an interesting comparison between 2019 and 2020 is a significant drop, not just locally, but regionally on call volume. And just give you a point of reference as far as an anecdotal example of how the preventive measures are being effectively utilized is with our total city staff relatively quickly following the directions that came out of our county health officer as far as the incremental closing and distancing of our workforce remotely. We've seen total of 11 city employees being persons under investigation or people that are concerned to be exposed to COVID. Since the start of this situation, all 11 have since been determined to be negative. And this comes of all different perspectives, police, fire, and all city departments. So I think that is or I believe to be the fact that is a direct reflection of the fact that as a city government, we followed the directions that was passed down, and it has allowed us to keep a healthy, effective workforce in place. Very, very good news. It was also great news to hear from the county that we're going to continue to loosen the restrictions. But I think you're all hearing the same important messaging is that we still need to follow the guidance of what's being afforded to us and not prevent a resurgence. So I am really, really excited by the positive news that's coming out that all of the actions are working and we're moving forward. As always, you've heard this throughout this situation is the city's open for communications. Ask your questions, whether email, phone calls, or text messages. We have every platform available to get your questions answered. And any basic question is applicable. I periodically check those information lines, and the text messages could be something as simplistic as, what are the hours of the test site? You know, they're there to help you to answer any questions you might have, whether they're business related, personal related, or just general information. So with that, I'm always available to anybody for any kind of follow-up conversations, and I'm very grateful for the collaboration that the Chamber continues to bring forward in these trying times. End of report.
Thank you very much, Chief. Thank you very much, Jacob, and thank you, Mr. Mayor. Desiree, were there any questions for any of these gentlemen?
No, I don't have any questions for them, but I just do want to note that I did put into the chat the number. Jeff got back to me of the number for the testing for the no symptoms. I did put that in the chat for you guys to call to make an appointment. It's 800-945-6171. And again, I put it in the chat.
Thank you, Desiree. Now we would like to invite Bob Blair from Kaiser Permanente to discuss some healthcare issues with us.
Good morning. Can you guys hear me?
We can.
Yes, we can, Bob.
Happy to join the Corona Chamber of Commerce this morning. And I'm going to introduce, you know what, I'll start with that. I want to come over here. We've got our masks on, but mine's off for a minute. This is Anna Maria Bearden. She's our new Director of Public Affairs. I wanted her to meet the Corona Chamber, and this is Bobby Spiegel on my screen right there.
How you
Some of
doing?
my favorite people. So she's new to Kaiser Permanente Riverside. Thanks.
Great to meet you.
So what I thought I would talk to you guys about a little bit is just give you a little bit, I'm going to move this back so you can see me, a little bit of perspective on how this COVID crisis has impacted us and what we're trying to do. I thought I might level set. I'm sure you've been hearing lots of information about this, so this may not be new information. It's interesting, you know, as we think about when we started and when the county was modeling what might happen as a result of this, the county was projecting 1,800 deaths in the county of Riverside. To date, we have 85 deaths in Riverside. And so social distancing and sheltering at home has definitely helped, we believe, to mitigate the spread of COVID-19 across our county. And even though that number sounds, and I mean, any deaths are unfortunate, but 85 compared to 1,800 sounds good so far. I think we're still concerned. We are still projecting in the county and at Kaiser Permanente that we're going to see a surge in admissions to our ICU probably by mid-May of this, you know, coming up. I think our peak is around May 12th, but it keeps moving a little bit as we watch this data. So we're watching it very closely. Let me tell you a little bit about what we've done to kind of adjust to this situation. Initially, when the COVID crisis began, our first focus as a medical center was to help to mitigate the spread of the virus. And so we implemented a universal masking guideline. Everybody was wearing masks. Visitors and employees are undergoing temperature screening. We're asking everyone whether they have had cold, cough, or flu. At least initially, that was a big area of focus. We've restricted inpatient and outpatient visitation, which is not always popular. So we're letting very few people into the facility. So unless it's a birth of a child or a really elderly person that needs assistance, we don't let visitors in with people coming for care to try to restrict their, you know, the potential that they could spread the virus or that they could become infected. And most interesting, I hope, to you guys is we Within about a week, we shifted all of our care, almost 90% of our care became virtual, which was pretty remarkable because before this crisis, patients weren't as willing to do video visits or phone visits. And honestly, doctors and nurses weren't as excited about video or telephone visits. And to ramp up that quickly to 90% virtual care has been pretty remarkable. And we believe that we might have some lasting effects of that change in people's experience with it. We've also been working very hard, as have our colleagues in healthcare in the community and the county, to develop a surge plan, or what we call a surge plan. So as we initially saw the projections and we were watching New York, they were fairly daunting projections, and we continue to be very concerned, but there was a point in time where we were feeling like we might have up to 400 or 500 patients at Riverside Medical Center needing a hospital bed, which would have required us to have a tent city in the parking lot of beds. Those estimates are going down every week as we see the things change, but we've been working very hard to procure equipment, ventilators, especially in PPE. You guys, one of the things I've seen the small business community do in some cases is we've had all kinds of people outreaching to us who have shifted their business into getting personal protective equipment, masks, face shields, etc. There was a huge crisis in our country, and for us here in Riverside, we could not get enough personal protective equipment for our staff. So that was a huge area of focus. We're getting better now. We've never run out of PPE, but we definitely had to be very thoughtful about how we were using our PPE. And if I had an area that I would say is extremely vulnerable, it's our skilled nursing facilities throughout the county. They probably are taking care of the most vulnerable patients. We're really trying to get our Kaiser Permanente patients into boarding cares or into the home with their families temporarily, and not have them be in the SNF, because some of the most unfortunate things we've seen happen in Riverside is SNFs that have transmission of COVID from caregivers that work in multiple facilities, and they transmit the virus to patients. And then all of a sudden, before you know it, many, many patients in the skilled nursing facility are positive, and that's a very vulnerable population. One thing I would say to you guys is, the transmission, while COVID is very contagious, we really think that the death rate is much lower than social media would have you think it is. Even if you look at websites throughout the world and in our country, they look at 3%, 2.5% death rates with COVID. We think those are probably a little inflated because we really haven't tested our whole population, which brings me to testing. That's another huge vulnerability we've had in our country and here locally in Riverside County. We have not had the ability to test people broadly for COVID-19. So Kaiser Permanente probably has more access to testing than most of our competitors and colleagues in the community. We've internalized a lot of our testing, and we can turn around results as quick as 15 minutes for some patients and 24 hours for most of the others. But we're very selective. We test people that are symptomatic or high-risk people. We're not testing the general population. And as business people, I would suggest to you that I'm not sure that screening the population with the current COVID testing is really valuable, because you test somebody and they're negative, and often we're even seeing COVID positive people that don't test positive for 2 or 3 or 4 days or even a week. And so the test is not necessarily very valuable. We should treat everyone like they're potentially infectious, socially distanced. The thing that we need to be thoughtful about, this is a large droplet transmission illness. Despite what all we read, it's not in the air. It's not something we're going to breathe unless somebody coughs on us. And so the most important thing we can do is wash our hands and not touch our mouth, our nose, our eyes, and that's really how this illness is being transmitted, is from people's hands to their mouth. In the case that somebody sneezes on you, you could get it if you didn't have a mask or a face shield on. We have canceled elective surgeries, and we've postponed them actually, which has really been difficult. But for the most part, patients have been very accepting of this. They don't want to come in and have an elective surgery done right now. And we've continued to leave those elective surgeries postponed until the 20th of May, today. And then finally, I guess, where are we going? And with all you guys, we're all concerned about, it was good for me to hear the city's update, and that was daunting to hear them talk about economically how this is impacting city governments. We're worried. Kaiser Permanente is worried about all of our employers and the people that we insure and the impact that this will have on them. And so we have really begun to ramp down our expenses and to really focus on what the world may look like when we do go back to work and people start to come back, and our business is going to fully come back. Are we going to see furloughs, layoffs, a higher unemployment rate, which we expect we might? And so we're very concerned about that with you. I think the other thing I would say is when we go back to normal may not seem like normal, obviously. We believe that probably for the next 6 to 12 months, there still may be risk in transmission of COVID, and people may be worried about that until there's a vaccination or an antibody test. I should have clarified, I think if we had an antibody test today, that would be a wonderful test for all of us to get, to see if we've been exposed to COVID and if we're COVID protected. And if we could get an antibody test available, that would be what we all need to be able to screen the population. So any questions? Or Bobby, how did I do? I hope I hit the mark.
You hit the mark pretty well. Desiree, is there any questions?
Yeah, just one. Many are concerned with a much worse second phase or wave. How are we managing this as we open things up, making sure people are following the guidelines?
So I think it's a great question, and we haven't actually ramped back up, and we're still doing, the majority of our care is virtual, but we are taking care of people that are sick. And interestingly, I would tell you that my employees and physicians who have tested positive for COVID, I think there's been like 45 of them. We've traced all 45 of them, and none of them have been have gotten COVID from a patient. So all of them theoretically are getting COVID from community spread. So it's really coming from friends, neighbors, shopping carts. I think the most important thing I can say is don't worry that you're going to get COVID for somebody with COVID, because probably if you know somebody has COVID, you're going to be extra careful and wash your hands and wear a mask. But we need to be careful. So when we go back to work, I think the most important thing we can do is be prepared to clean surfaces, to wash our hands more frequently than we're used to. Probably we're going to be wearing masks, or we're at least going to be social distancing for quite a while. And I do think in the business community, as things go back to normal, you can definitely build back a level of safety in your business and limit the spread of the virus. And if you think about the flu, it's interesting that nobody panicked about the flu, because we have a lot of deaths from the flu every year. And so I would think in flu season in general, this may be a healthy realization in our country that we just need to be more careful, wash our hands, and all those things are going to help to limit the spread of COVID. And we'll see how we get to your question. We'll see how, if we see spikes as people go back to work, as we start to bring patients back, we're going to be watching really closely to see if we see spikes in ICU admissions, patients on ventilators, and hopefully, given all the safety measures we put in place, we will not see that spread. Hope that answers the question.
Thank you so much.
Thank you, guys. I know your time's limited. I appreciate the time to spend with you.
No, we appreciate you taking your time.
Thank you, guys.
Finally, I'm excited to introduce our featured speaker today, which is Leslie Trainer from the Workforce Development for the County of Riverside. Leslie?
Thanks, Don. Good morning. Can everybody hear me okay?
We're good. Thank you.
Okay, great. As introduced, my name is Leslie Trainer. I'm with the County of Riverside Workforce Development. And I do have a PowerPoint to share with you.
There you go.
Okay, great. Thank you so much, Desiree.
Absolutely.
So I wanted to share with you, if you want to go to the next slide, please, some information about services that we provide at the County Workforce Development, but also information about our very close partners that we work with, the State Employment Development Department, some great programs and resources they have available, give some general resources, and the information is really applicable to the folks who are on the phone who are employers or themselves are employees or want information that they can pass along to their employees. You're going to see that there are a lot of links embedded in this PowerPoint, and I've provided a copy of the PowerPoint to Desiree, and perhaps we could find a way to disseminate it so that if you wanted to click on any of these links and further explore or read information, you can do that. But in any case, what you see in front of you is some of the territory I want to cover today. So for each of these items, I want to look at an overview of what the program or resource is, go over important eligibility information, give you information on how to apply for any of these benefits, and then also look at these programs from the employer side as well, so we can kind of see both the benefit to the employee and the benefit to the employer. So next screen, please. And we'll start out with the services that we provide at my shop, which is Riverside County Workforce Development. We have workforce development centers throughout the county located in Riverside, Indio, and Hemet, with access points in Moreno Valley and Blythe. Those centers are closed to the public right now, but the county staff at Workforce Development are on duty. I am at my office right now in Riverside. We do have several folks who are telecommuting, but we are actively serving members of the public, both residents and businesses throughout Riverside County. We are on the learning curve, just like everybody else, with figuring out how to continue providing services remotely so that we can provide benefit to residents and businesses without necessarily seeing folks in person. So some employer benefit services that we provide. We can help with recruitments and job fairs and application screenings. There are certainly employers who are looking to hire right now, and we're here to assist. We look at ourselves as a matchmaker, those employers who want to hire. There are folks who have been laid off, and we try and match those two groups of people together. So we can take stacks of applications that you might be considering and help you screen through to sort through the applicants to find maybe a handful for interview. These are all free services we provide, so I definitely recommend you take advantage. And you'll notice on the screen in the bottom right-hand corner, there's information for how you can contact us and ask questions or request any of these services. We also offer business process improvements. We're here to support our local employers in any way we can, because in order to have a robust workforce development ecosystem, we have to make sure that our employers are solid and prospering. We can also provide reimbursement to employers for up to 50% of a new employee's wages while that new employee is training. It's beneficial to the employer. You get to train a new employee on the job at your site as you see fit, while we're also allowing a person who is maybe not working before to have a job, to build their resume, to learn new skills. Unfortunately, recently, one of the activities that we've been participating in most often has been our rapid response program. And for rapid response, what happens is there's a federal act called the WARN Act, and that stands for Worker Alignment and Retraining Notification. And there's a requirement that if an employer is going to undergo a large-scale layoff, that the employer notifies certain entities, including the State Employment Development Department, the chief local elected official or their representative from the Board of Supervisors, and the Workforce Development Board. So for workforce development, being part of the Workforce Development Board, we receive those WARN Act notices. So we are aware when there's going to be a large-scale layoff, and we immediately contact the employer and see how we can support in assisting those affected employees, referring them to the county's Workforce Development Department for assistance in finding another job, providing information to those affected employees on how to apply for unemployment insurance, and even giving information about what to do with healthcare. Going over COBRA options or providing them information about Covered California. And most of these services that are offered through the county are funded through WIOA, and that stands for the Workforce Innovation Opportunity Act. It's the major source of funding from the Federal Department of Labor that's disseminated through workforce development boards and allows us to fund these types of programs. Next slide, please. So staying on services provided through Riverside County Workforce Development, also wanted to give a summary of what we provide to employees or workers or individuals who were working and have been laid off. And again, these are all free services. So different people need different levels of help. Some folks just want assistance looking over their resume to make sure it looks okay. When our centers are open, we get a lot of folks that come in because maybe they don't have a computer or access to the internet, or maybe they do and they're just not comfortable working on a computer or in a Word document to create a resume. So we can assist with resume writing. We do mock interviewing, so folks come to their interviews prepared. I know we hear from employers that they appreciate that. And in fact, just 2 months ago, one of the major issues we were having at that time was employers telling us there are not enough people, there aren't enough qualified people. And when they show up for an interview, they don't seem ready. Things have changed dramatically. They have dramatically pivoted over the last couple of months. But interview preparation is still incredibly important no matter what the economic status. We also provide career coaching. So if somebody is, if they're displaced, if they're laid off during the COVID crisis, we can talk to them about what their options are, what the next steps would be, and point them in the right direction. We also have boot camps and workshops that are designed to get workers work ready. These are programs and services that we are transitioning to an online platform so that we can give the information in as meaningful a way as it would be if somebody were here in person. Another large service that we provide that we are known for is subsidized vocational training. If an employee is laid off and they need to upskill in order to get their next job, or maybe they are working but they're underemployed, they're working part-time, or they're working in a job that doesn't maximally leverage their potential or their skill set, we can provide training. We can refer them to training providers for vocational sorts of training, and we can pay for up to $8,000 in vocational training costs per person, which can really kick the door open for a lot of people in terms of their career pathways and their professional prospects. We also have access to quite a few local partners. One of our biggest is the State Employment Development Department. They're located at most of our facilities. We work very closely with that, and that has very much come in handy over the years, and in particular during the COVID crisis where a lot of folks are needing unemployment insurance. But what some people don't know about the Employment Development Department that I want to make sure I leave with you on this Zoom meeting today is that they are a really rich source of labor market information and data. So if you are an employee who is looking to change the industry where you're working, or if you're an employer and you want to make strategic decisions and you need data and information to do that, EDD is a fantastic resource. They have a website with all kinds of data that's free to you, and they can also do specialized, customized requests for minimal charges. So that's a great resource to be aware of. We also partner with community colleges. They're great training partners for us. Department of Public Social Services for employees who, especially lately, we see folks who are laid off who need any and all help possible. Sometimes that is WIC for parents with young children. Sometimes that's CalFresh, or what's called SNAP, income funds to pay for food. General assistance, we can provide referrals to the county's Public Social Service Department for that. Veteran services, lots and lots of specialized good stuff for those who have served our country. And Department of Rehabilitation is a good partner for individuals with disabilities too. So if you are a worker or know of a worker that has needs that fall under any of those categories, please give us a call. We're happy to help, and we're happy to refer to our partners who can assist as well. Next slide, please. All right, so this is where I want to go into just sharing some general information, making sure everybody's aware of programs that are offered by our partners at the State Employment Development Department, or EDD. One of those is work sharing, and this is a program that's been around for a while, long before the coronavirus, long before Corona was known for better things than the coronavirus. So the work sharing program, though, EDD has indicated that they have been receiving an unprecedented amount of inquiries on it. And it's a good way to summarize work sharing is for employers who are experiencing a reduction in demand, and you're trying to look for solutions that prevent you from laying individuals off. Work sharing program is a way to do that. It allows employers to leverage the use of unemployment insurance while also reducing hours without laying staff off. And so the benefit is obviously you're keeping your current staff, your current employees. You don't have to incur the costs associated with laying people off and hiring and training new folks. For employees, the benefits are good too. You keep your existing job while you also receive unemployment benefits. So your financial situation is good while you still have that job with that same employer. Next screen, please. So as far as who is eligible, this is an employer-focused program, so it's the employer who applies for the work sharing program, and you just have to be registered with the state. You have to have an active California employer account number. Your hours and wages to your employees need to be reduced between 10 and 60%, and you need to be looking at a reduction in hours and workforce that affects a minimum of 2 employees or 10% of your workforce. So there are links to click there for additional information and for how to apply. So you heard me say that work sharing is a way for employers to balance the use of unemployment insurance with a reduction in hours. So 50% of the equation in that program pertains to unemployment insurance. So for unemployment insurance, I wanted to give a little bit more information on it for employers interested in the work sharing program, but also because unemployment insurance has just been a super hot topic. Pretty much any conference calls I've been on, there are questions, lots and lots of questions surrounding unemployment insurance. So I wanted to give a brief overview, although I feel that most of us have become way more educated on unemployment insurance than we ever anticipated we would be. But I want to make sure that everybody's understanding of it is clear, in addition to giving you the most recent updates. So unemployment insurance is actually a federal program. It's a program where the money and the guidance starts at the federal level at the Department of Labor. The Department of Labor then sends out guidance and monies to the states. And in the state of California, the agency that receives that money and administers the program is EDD, or the Employment Development Department. One of the reasons why they're such a key partner for us at Workforce Development. Right now, there are 2 different types of unemployment insurance that you're probably hearing about. One is regular old unemployment insurance, which has been around, and the other is expanded unemployment insurance that I'm referring to in these slides as pandemic unemployment insurance, or pandemic UI, that came from the CARES Act, which the CARES Act, by the way, stands for Coronavirus Aid, Relief, and Economic Security Act, if anybody wanted to know. And if you ever find yourself with insomnia, there's a link for the CARES Act. It's about 300 pages long. It's the act itself, so it'll put you right to sleep. But if you wanted to know, it's there for you. So I want to go into a little bit more detail about each of those, the regular unemployment insurance and expanded pandemic unemployment insurance. On the next slide, please. For regular unemployment insurance, you're probably well aware that individuals need to have been employed and then be totally or partially laid off through no fault of their own to qualify for regular unemployment insurance. You also have to have an adequate track record of employment earnings from which EDD draws from that pot of deposited unemployment insurance funds to pay you those unemployment insurance benefits. There's some links there for more information on that. For pandemic unemployment insurance, it's a very different set of rules and requirements because pandemic unemployment insurance is coming from that fairly new CARES Act. So this is very good news for people who are self-employed or independent contractors or gig workers who did not qualify for regular unemployment insurance. You are eligible to apply for pandemic unemployment insurance, as are people whose regular unemployment insurance benefits have extinguished or exhausted, or they don't have enough of a work history to have qualified for regular unemployment insurance. So if you or somebody you know has previously applied for regular unemployment insurance and was not eligible, you may want to take another gander at pandemic unemployment insurance to see if you may qualify for that instead. So on the next slide is information about what the benefits look like for regular unemployment insurance. The amount of benefit you receive really depends on what your earnings were, but the benefit is normally between $40 and $450 per week, and those benefits last up for about 6 months or 26 weeks. For pandemic unemployment insurance, the additional benefit is up to $600 per week. So very, very worth looking into. And for some individuals, they may be able to receive regular unemployment insurance plus pandemic unemployment insurance to feel additional financial security during these times. On the next slide is some information on how to apply. And I want to preface any information about applying for unemployment insurance with the chart that you see on the right. So it shows you over several weeks' time the number of claims or applications for unemployment insurance that EDD has received. And in just the 1 week from March 21st to 28th, they experienced a 370% increase. If you do the math from that first week on the chart, which is March 7th, to the last week, it's an increase of something like over 1,000%. So they have been hit hard with an unprecedented spike in requests for unemployment insurance, and their phone lines very much reflected that. We get a lot of information that people are having difficulty getting through. So bear that in mind if trying to apply, and I have another document I can provide to Desiree that gives tips and step-by-step instructions for applying for unemployment insurance. And Bobby, you just let me know how I'm doing on time.
Okay. So can you hear me?
I can.
Okay. So we are actually real close to the time frame, and we've got some questions. If it's okay that we can just jump into those.
You bet. Can I add one other thing, which is there's lots and lots of information on these slides and the links. And Desiree, if you jump to, I think it's the second to last slide, I want to add, yeah, right there. If you are or know of a Riverside County manufacturer or distributor of COVID-related products that are listed there, masks, ventilators, gloves, gowns, face shields, goggles, we at Workforce Development are wanting to support you. So please reach out to me if you are or know of a manufacturer or distributor of those products. The last page has my contact information if you come up with any questions after this. And then happy to take any questions.
Awesome. Desiree, would you take it up on with the questions? You're muted.
I know. Hold on. Let's see. Let me get into the chat. Hold on, Bobby.
Sure.
I have a question, Bobby. When you're
Mike, we're doing it. You got to put it in the chat, buddy.
Okay.
Type it into the chat. Thank you.
Okay, so we have one question. As employers, we are really concerned that workers are extremely deterred from taking jobs because unemployment can be $1,050 a week. I believe this could stunt our recovery.
That's a good point. And frankly, coming from the housing world, where we provide assistance with Section 8, we have the same conversations quite regularly. You know, you're balancing, it's a fine balance between subsidizing and assisting folks financially, but making sure you're not incentivizing that dependence. I do believe that the state has put in place some timeframes that limit the amount of time that an individual can receive benefits. In addition, another safety net is that the state in their regular unemployment insurance does require that individuals receiving benefits are available to work and actively looking for work. They have paused that requirement for now because of conditions, but I would imagine that as things open back up and loosen back up and more people are safely able to go back to work, that they will re-implement those requirements that have people looking for work and require them to take jobs for which they qualify. So that's a very valid concern.
Another question is, have WARN Act penalties been waived?
So there is a link that I included on one of these pages with additional information. It says additional resources. It's in the PowerPoint. There's a link to the EDD and their guidance on WARN notice. They have eased some restrictions on WARN notices. And so I would encourage anybody who has questions about WARN notices to visit, to click on that link and visit the website and get the information firsthand.
Thank you. We're going to have to go ahead and end right now. We'll get the questions over to Leslie and we'll get those wrapped up because it cuts us off in about 45 seconds, I believe. So I just wanted to remind you that next week we have from the Workforce Development from the state of California, the chairman of the board. His name is Angela Farouk. He will be our keynote on the call. And then Desiree, can you slide up the CARES Act slide? Do you have that accessible? And at 11:30 today, we have Simon Kinda, who is an attorney that's going to go through a question and answer period for all the different things on the CARES Act. And there's a slide that's going to come up and you can register right there with the bit.ly /CARES SQ-A-422. Thank you all so much for being on the call today. I so appreciate each and every one of you. Have a great day.